Obstructive sleep apnea is where the airway of a person is inhibited during sleep due to the tissues around the throat constricting. This can be a serious problem and lead to many other issues. Let's review. When sleeping and laying horizontal, the airway gets pinched to a much smaller diameter than normal, sometimes completely stopping breathing. This causes the brain to wake the person out of a deep sleep and take a more forceful breath. This can happen many times a night, up into the hundreds of times. Not only does this mean that the person's oxygen saturation in their bloodstream drops low, it also means that the person doesn't get a good restful sleep. To learn if you have sleep apnea, a proper sleep study is recommended, but you might also be able to see the symptoms in everyday life. Typically, symptoms include excessive sleepiness, loud snoring, and if your sleeping partner observes episodes where breathing is stopped. Snoring doesn't automatically mean you have sleep apnea, but is a risk factor. Sleep apnea doesn't directly cause high blood pressure and excessive weight gain, but obesity is a risk factor for obstructive sleep apnea. Men are more at a risk for OSA than females, and obesity is a huge causing factor in sleep apnea. If you feel you have risk factors or would like to discuss dental treatment options with your doctor, ask about taking a sleepiness test or get a sleep study. In the dental field, we have many different devices that can help treat obstructive sleep apnea.